Magandang umaga po sa inyong lahat, sa ating DOH Health Beat reporters at sa mga nanonood po sa atin sa social media platforms ng Department of Health. Today we will be having a special presser for our experts to report the latest results of our whole genome sequencing. So ngayong araw po, July 16, 2021, narito po sila Dr. Cynthia Saloma, Dr. Eva Maria Cutyonco de la Paz, Dr. Ana Ong Lim, Dr. Isa Alejandria, Dr. Edsel Salvania, at kasama din po natin ang ating key implementers, ASEC Manuel Felix of the DILG and ASEC Odilon Pasaraba, same po no, mula din sa DILG. Ngayon po, to make the special announcement, we have our official spokesperson, Undersecretary Maria Rosario Singvergere. Yusek.
Good morning to all of you. Welcome to our press conference this Friday, and our experts and our partners from other national government agencies are here. Sa ngalan po ng ating Secretary Francisco T. Duque III, ang Department of Health, the University of the Philippines, Philippine Genome Center, and the University of the Philippines National Institutes for Health report the detection of 16 new Delta variant cases, including the first local cases based on the latest whole genome sequencing report. 5 of the 16 cases are returning overseas Filipinos. 1 case arrived in the Philippines from the United Kingdom on April 26, 2021, has been tagged as recovered after undergoing the 14-day quarantine period. Another 2 of these cases arrived in the Philippines from Qatar on June 15, 2021, and have also been tagged as recovered. The Department of Health is still verifying the arrival and the quarantine status of the 2 other returning overseas Filipino cases. 11 cases are classified as local cases. 6 cases had been detected in Region 10 and are part of a large cluster of cases with dates of onset between June 23 to June 28. All of these individuals had been tagged as recovered. 2 cases have also been detected in the National Capital Region. 1 case was tagged as dead after being rushed to the emergency room of a hospital on June 28. The other case is an outpatient with an onset date of June 23, who was tagged also as recovered already. On the other case, an outpatient with an onset date of June 27 was also tagged as recovered, was initially tested here in the National Capital Region, but has an indicative address in Region 3. All of these cases have no known connection to each other. The last 2 local cases were detected in Region 6, both with an onset date of May 27. Both also had been tagged as recovered. With our 4-door strategy, we have delayed the entry of this Delta variant with the activation of doors 1 and door 2. Now that we have detected additional cases of Delta variants, and because they are local cases, we are now activating doors 3 and 4. Door 3 would involve strengthening the implementation of our PDITR strategies to immediately detect and isolate possible COVID-19 cases, while door 4 is ensuring that our healthcare capacity is ready for a surge. The DOH is currently coordinating with all of our centers for health development and local government units to ensure that all cases had been or appropriately traced and managed. The Bureau of Quarantine and the Department of Transportation are on high alert to implement stricter border control measures. The DOH underscores that the spread of COVID-19 globally, while being controlled by vaccination, is still being driven by the emergence of these variants of concern, increased social mobility, and inappropriate use of public health measures. Even while we are vaccinating our Filipino people, minimum public health measures such as physical distancing, face mask, and face shield should not be neglected. With this, I give the floor to Director Althea de Guzman to give us details on our latest findings.
Thank you very much, Yusek, and good morning to our media partners. Let me just start sharing my screen. So this was the results of the latest run, but I'd like to first give po no, a short update about the Delta variant. Quickly lamang po, na ito po nga po ay matagal na no, at una na nating nahanap noong Desyembre pa. At kaya nga po natin to binabantayan dahil nakita natin na kumalat na po ito sa 98 countries globally. The two things that we are on the lookout for the Delta variant is one, it is more transmissible on top of the Alpha and Beta variants. And some of the reports provided by countries where we already have large spread of this Delta variant show that there is correlation increased hospitalization. No? So meaning, nakikita nila may 2 beses no, or twice as high na risk na ma-hospital ang mga kaso na mayroong Delta variant of concern. But I think one of the things you also need to emphasize, they also showed no, that the provision or having 2 doses of the vaccine remain to be very effective against the Delta variant. And if we only have 1 dose of that vaccine, the protection afforded to us may be only as low as 33%. Pero pag tayo ay nakadalawa, it can be as high as 60 to 88%, depending on the vaccine. This is also the reason why we are closely monitoring the detection and spread of this Delta. Again, it has already spread to a large number of countries and is even tagged as a dominant variant in several countries such as US, India, and UK. And in the ASEAN, we have already detected this in 8 of the ASEAN countries. No? And Dr. Cynthia will further elucidate on that later. Kaya lamang po nakikita nga po talaga natin doon po sa mga kapitbahay nating mga bansa yung epekto ng Delta variant. In Malaysia, their cases reached as high as 11,000 cases, and it is shown on the line graph sa may kanan kung gaano kabilis yung pagtaas ng kaso. But for Indonesia, it reached a record high of 54,000. And we can see that the line is almost a straight line, no? Ganon po ka-steep. And this is what we want to ensure, prevent na mangyari po dito, and the need to really strengthen yung pong ating PDITR, vaccination, and other interventions po. So we have already sequenced a total of 8,557 samples. There were 679 samples where we had lineages. At ito po yung breakdown kung ano po yung mga nakita natin sa ating 679 samples. We were able to detect the B117 or the Alpha variant from 264 or 39% of the samples, the Beta variant from 299 or 44% of the samples, and an additional 16 Delta variant cases comprising 2% of the sequence samples. Of the 8,557, our incoming international travelers comprise 7.6% of those with a VOC detected po. Currently, the Beta variant is the most common variant, and it comprises 23.35% no, ng lahat ng samples na meron po tayong nakitang sequences. At ito po ay sinundan ng Alpha variant at 20.52. At ito nga po, meron tayo ngayong total of 35 Delta variants. This is a cumulative percentage. If you will notice, the sequencing we're doing in the most recent runs are very targeted. Meaning, pinaprioritize po natin ang mga nanggagaling sa ibang bansa, yung mga incoming international travelers, at yung pong mga areas kung saan tayo nagkakaroon ng spike. Kaya naman, nakikita natin na sa bawat run po natin ng mga nakaraang linggo, malaking porsyento po talaga ng nakikita po natin ay mga VOC na po. Gusto ko lang pong ipakita ano po ba yung distribution ng ating 16 na Delta cases. So, nabanggit nga po ni Yusek na of the 16, 5 were returning overseas Filipinos while the rest were tagged as local cases. Of all of these, 15 have already recovered and we had 1 fatality. Majority were females with ages ranging from 14 to as old as 79 years old. Sa ngayon, ito po yung nakita naming mga pinanggalingan ng ating mga ROF. Meron po tayong 2 na inaalam natin saan po sila nanggaling. No? Ang nakita po nating clustering ay ang isa pong lugar sa Region 10 as well as yung pong lugar po sa Region 6. Lahat po ito ay na-endorso na natin sa ating mga regional offices at nagsimula na po sila ng pag-iimbestiga, yung tinatawag po naming backtracing para malaman kung saan po nila posibleng nakuha ang information at yun nga pong contact tracing para malaman po kung meron pa po tayong additional layer na nagkaroon po ng infection. Gusto ko matapos sa ating further strategy. We've always said that the DORS 1 and DORS 2 are there to prevent or if not delay the spread. At the same time, we're strengthening DORS 3 and 4 so that now that we have detected these Delta variants of concern, we can prevent ourselves from being overwhelmed by strengthening our PDITR and vaccination policy and ensuring that our TTMFs and our health facilities will be adequate so that if a surge does occur, we can be more capacity. We have better capacities to address them. So yun lamang po, Yusek. Thank you.
Maraming salamat po, Director Thea. Para po sa susunod na presentation, I will be asking Dr. Cynthia Saloma to give us an update. Ano nga ba yung timeline ng Delta cases across the ASEAN countries?
Hello, good morning, everyone. Can I share my screen? Okay, pa. So good morning, everyone. Let me share my screen now. My slide is very short. So I'm going to give you a brief background on the emergence of the Delta variant or the variant B.1.617.2 in Southeast Asia. So if you have the opportunity, you may also visit the GSAID database, where you will see, for example, the transmission chain from India to the different parts of the world. So here you can see, for example, that there have been a lot of cases detected in Japan, as well as, of course, nearby in our country, in Indonesia, in Malaysia, in Singapore, as well as in other countries. So just to give you a statistic. So the emergence of the of the Delta variant in Southeast Asia. So if you look, Dr. Thea mentioned about 98 countries where this has been reported. Based on the sequences that have been submitted so far, of these 98 countries, 96 have submitted their whole genome sequences of the virus in the GSAID database. So ito po yung GSAID is the global initiative on the sharing of all influenza data. So far in the database, about 170,000 sequences of Delta have been shared throughout the world. And the earliest sample of the Delta variant was recorded on September 7, 2020 in India. And the first detected in Southeast Asia, as far as the sequences that have been shared to the database, is last January 7, 2021. And this is a sample from Indonesia. So if you look at this color graph at the bottom, you will see, for example, that, of course, it was detected first in India, but there are a lot of cases detected in Indonesia, as well as, of course, some are in Singapore, Japan, and lately in the US and in the UK. So Dr. Thea de Guzman has mentioned to you a while ago about the defining characteristics of the Delta variant, and that it has been estimated to be 60% more transmissible than the 60% more transmissible Alpha variant. So if you see here, there are several defining mutations in Delta, the most notable of which is the L452R. So these are defining mutations, and the P618R. So these regions of the genome have also been detected in other variants of concern, except that instead of R, it's different from other cases. So for example, in the Alpha variant, the 681 here is H histidine. In this particular case, it's arginine. And of course, the L452 is arginine also in the Delta variant. So let's continue. So I think this is also my last slide and the simple slide. So if you look at the database, so please be very careful that the figures here are really dependent on the submitted database, whereas the reports in newspapers might probably more current, but this is as far as supported by sequence data. So the country with the most deposits of Delta variant so far is Singapore with 1,052, followed by Indonesia with 723, Thailand with 144, and Vietnam with 72. So this is as far as GSAID is concerned. You will notice, for example, the relative percent delta of the sequence cases they have in the last 4 weeks. So this is current. So you will notice, for example, that of course, every country has limitations in terms of sequencing because no one can sequence all these variants at the same time or 100%. But as far as the sequence variants that have been shared by Indonesia, 91.2% of the current sequences they have are all under the Delta lineage. So in addition to that, Singapore, of the sequence cases of Singapore submitted in the last 4 weeks, 90.1% are also Delta. This is also probably a reflection because they're doing purposive sampling in cases where they have surges. If you look at Malaysia, here we have 70.6% submission. In the Philippines, actually, it's 0% because we have not yet updated the database. So now we have 35, when initially we have shared to the global community 12 whole genome sequences. Cambodia, interestingly, also has 31.7% of the sequence cases being Delta. So here we see that the earliest detected Delta variant, if you have September in India, I think the September, this is January 7, 2021. So that is the earliest we have. For our country, the earliest we have detected was actually on a biobank or biobank sample of a returning overseas Filipino, and that was swabbed on April 15, 2021. For example, in contrast, Singapore, which also has a lot of South Asian populations in the local population, the earliest known case or reported case or sequence was collected or detected on February 6, 2021. So in contrast to Indonesia and Singapore, the rest of Southeast Asia more or less have sequences detected from April to May. In the worldwide community, if you look at the earliest one, we can see the earliest one is essentially from the UK, which has the most robust genomic biosurveillance system in the world. 98.8% of the last 4 weeks cases are actually Delta variants. So far, UK has already recorded 136,253 Delta variants. The United States has shared 15,047 Delta variants, and the recent 4 weeks has shown that of these sequences that they have submitted in the last 4 weeks, 59.7% are actually Delta. So this may not necessarily reflect the prevalence in the population because this is based on those submitted sequences in the database. So in the US, for example, there are estimates of 20 to 30% prevalence. But as far as the sequences they have shared, it's 59.7%. For Japan, about 51% of the last 4 weeks are Delta. For Israel, for example, which has a robust genomic surveillance system, the last 4 weeks have shown that 98.4% of their sequence cases are all Delta. So the earliest cases have been detected in the US as well as in the UK, whereas in Japan, March 28, and of course, April, the latest one is Taiwan, where they only have shared one. That was in June. So take note, for example, that it is 0% because they have not reported. Either they have not reported as far as the database is concerned, or they just have not updated their data. So that's all from my end, Laura.
Thank you so much, Director Cynthia Saloma, for giving us an overview of the spread of the Delta variants across the globe. Now that we have seen local cases of Delta variants in the Philippines, we're activating doors 3 and 4. Pero paano ba natin pinaiigting ang biosurveillance efforts ng Pilipinas? Para dyan, I give you the Executive Director of the UPNIH, Director Eva Maria Cotyonco de la Paz. Dr. Eva.
Thank you, Ms. Laura. Magandang umaga po sa inyong lahat. Ang genomic surveillance po is part of our whole nation approach to be able to recalibrate and make changes to policies, measures, and strategies that we do in the fight against COVID. So in my part of the presentation, I'm going to talk about the SARS-CoV-2 genomic sequencing expansion efforts of the country. Right now, our current capacity for sequencing, if you can see these three sequencers, they're all at this next generation sequencers are all at the UP Philippine Genome Center. On the leftmost is the NovaSeq, which is the highest throughput of our sequencers. In the middle is the NextSeq 500, and on the right is your MySeq. So their differences is their output capacity. We thank the government, especially through a grant from the Commission on Higher Education, Philippine California Advanced Research Institute, because a number of years back, about 4 or 5 years ago, our country has been equipped with this state-of-the-art next-gen sequencing technology, not realizing that it will be most used during this critical time of our lives. And because of the support from the Department of Science and Technology, as well as the Department of Health, we are able to sequence about 750 samples a week. But we can most certainly do some small runs to be able to address special issues should the need arise. So in our expansion efforts, we would like to focus on increasing the number of active cases sampled for genomic sequencing, followed by adequate representation from the regions, especially in the areas experiencing a surge or clustering of cases. So we have to be able to sequence a reasonable number for us to be able to have a more meaningful genomic biosurveillance, just like what we're doing now, but we want to strengthen that some more. And lastly, to be able to determine the phenotypic impacts of the variants of concerns, like increased transmissibility, disease severity, risk of reinfection, as well as evaluating the performance of the vaccines against variants of concern, which are always something that our public needs to know. Increasing local biosurveillance capacity involve 3 important components, which include, of course, increased requesting for some more equipment and supplies, training for manpower resources, and a very specialized field of data analysis called bioinformatics, which includes also important servers and storage space, as well as equipment that will allow us to analyze our data accurately. One of the more major important things is really strengthening the core disease surveillance by the epidemiology and surveillance unit, which is critical for a stronger surveillance system in the country. Our initial expansion efforts, these are just initial efforts. There will be more as the days, weeks, and months go by. We will be expanding our sequencing efforts to 2 satellite facilities in the country, and that's the Philippine Genome Center in Visayas, which is housed at the Regional Research Center of UP Visayas, and another facility at the Philippine Genome Center, Mindanao, to be housed in the Future Research Development and Extension Building of UP Mindanao. These 2 have now been set up through funding from the Department of Science and Technology. So all our efforts will be geared towards strengthening our genomic surveillance in the whole country. That's all. Maraming salamat po for your attention.
Maraming salamat, Dr. Eva Maria Cationca de la Paz. Before we continue on, I'd like to acknowledge Secretary Charlie Galvez and Yusek Epimaco Densing of the DILG. Next on our list po is Takto. with this activation of doors 3 and 4, pinapaigting natin yung biosurveillance po natin. Ano naman po kaya ang masasabi ng one of our experts from the Technical Advisory Group? Ano po ang call to action and recommendation po ninyo? Dr. Ana Onglim?
Thank you very much, Laura. So let me just get my slides online. I hope you're seeing this, no? So nakita naman natin na panay ang pagbabantay ng ating sistema, ng ating authorities sa pagpasok ng mga iba't ibang klaseng variants. And even before this happened, marami nang ginagawa behind the scenes para maghanda kung sakasakali mangyari ito. So for this part of the presentation, what I'd like to do is to share some specific calls to action and recommendations and reminders, no, for our teams as well as the general public ngayon na nagkaroon na ng bagong detection ng mga Delta variants. Unang-una na ang reminder na kaya ganun kahalaga yung quarantine process natin as na ini-implement sa dumarating na mga travelers, no. Mahalaga yung strengthen ng border control dahil kinikilala naman natin na karamihan ng mga pumasok na variants ay nanggaling sa returning travelers. So I hope, no, this helps people to understand kung bakit gano'n na lang yung ating insistence na pagka may dumarating, kailangan pong mag-quarantine. And even as we recognize the inconvenience, no, of this action, it really has been a significant factor in delaying the entry of some of our variants, and particularly also of Delta. So sa ngayon, ini-implement pa rin natin yung ating 10+4 strategy for the unvaccinated individuals and a slightly shortened quarantine period dun sa mga nabakunahan na at may maipapakitang validated vaccination certificate. Pero once napayagan na pong umalis galing sa quarantine ng isang returning traveler, nasa sa responsibility din naman ng individual at ng LGU na ma-implement pa rin yung remaining number of days na kailangang nasa bahay pa rin ang returning traveler para makumpleto ang kanyang quarantine. Hinihiling din natin sa mga LGUs na sana maging mabusisi, no, tungkol dun sa mga rates of reported cases sa kanilang lugar para kung kinakailangan ang pag-i-implement ng mga localized and granular lockdowns ay maisagawa ito ng sa lalong madaling panahon. The next systemic response is also to increase healthcare capacity, no, to anticipate a surge. Alam naman natin yung mga nakita natin sa iba't ibang bansa na kung saan pumasok ang Delta, talagang mabilis ang kanilang mabilis na napuno, no, ang kanilang healthcare capacity, na overwhelmed. So we don't want to be in that same situation. And because we have genomic biosurveillance in place, this is really one of the important tools that has allowed us to keep one step ahead of the game. And hopefully, no, with a more cooperation, no, from the different regions from whom we are requesting samples, mas lalo pa nating ma-enhance yung genomic biosurveillance natin. And again, no, the point is to keep ahead of the game as much as possible. Hindi pa rin mawawala yung PDITR strategy. And this is really a very key point, particularly now that we're seeing some local cases. Siguro ang isang reminder, no, para sa atin, so since so far lahat ng mga nababanggit pa ay systemic responses, ito naman ang hinihiling natin for individuals. Pagka kunwari meron na po tayong naramdaman na simptomas, wag na po nating patagalin pa. Nasa sa kamay natin yung agad-agarang pagkukonsulta at pagpapatest. Dahil whenever we are able to decrease the time between onset of symptoms and identification of a positive case, bumababa yung possibility na lalo pang kakalat ang sakit galing dun sa positive case sa ibang mga tao and from those who are quarantined to other people in the community. I cannot overemphasize this enough, no? Kasi ito pwede nating gawin as individuals. Wag na po natin pakiramdaman ng simptomas, magpa-test na po kaagad. Hindi pa rin dapat kalimutan ang minimum public health standards. And in fact, I would say na dahil we continue to emphasize this, isang malaking bagay ito na maaring nakatulong dun sa pagpigil ng pagkalat ng sakit. Another thing that we have to realize also is that now that we have a more transmissible variant circulating locally, then we need to make sure that no mass gatherings are held, and even yung small social gatherings that are held within families or work groups should be we should rethink these gatherings, which because they can really be potential super spreader events. And finally, ang talagang malaking pagbabago na meron natin ngayon compared to earlier in the pandemic is the fact that we have vaccines. And if there's any other reason that people will need to be motivated to be vaccinated, ito na yun. Sinasabi natin na ito talaga ang malaking tulong na pwede nating samantalahin. And I hope that people who are already qualified, if you belong to A2, A3, and A4, which is currently what's being rolled out, please be vaccinated. Ito ang isang pwede nyo itulong sa sarili nyo, sa pamilya ninyo, at to the entire community. Maraming salamat po.
Maraming salamat, Dr. Ana. On that note, ano nga ba ang gagawin natin sa ating allocation of our vaccines now that we have detected more cases of the Delta variant? To give us vaccination updates and the distribution of vaccines, especially in flagged areas, I give you Secretary Charlie Galvez. Sec Charlie.
Magandang araw po sa ating lahat. Salamat po sa DOH and sa ating mga stakeholders for inviting me here in our special media forum. I would like to share to you our good news. The Philippines reached the 14 million mark despite some delay on the deliveries. We are also expecting to increase our throughput, or yung tinatawag nating administration, in the succeeding weeks this month with expected arrival of additional roughly 9 million vaccine. Last week, at least 3.2 million AstraZeneca vaccines from the donation of Japan and COVAX, and the 170,000 doses from Sputnik have arrived. This week, we have received 1 million Sinovac, and then also we have 250,800 vaccine of Moderna that arrived yesterday. Kaya nga po naka-best ngayon, I just received now, just this morning. We welcome the arrival of the 1,150,800 doses of AstraZeneca, which were procured by the private sector and the local governments. Sir Joey is very ecstatic kasi more than 8 months namin pinaghirapan itong kontrata na ito, at kami nagpapasalamat sa ating private sector sa kanilang pagtulong sa ating pag-increase ng volume ng mga vaccine. This afternoon, we also expect the delivery of 1.6 million, to be exact, 1,606,600 vaccines of J&J. This is the first tranche of the delivery of doses coming from the shared donation of COVAX and the US. We would like to thank the US for their generosity. Based on the guidance of the President, we will visit areas that have high cases of COVID-19. We will reallocate our vaccines to the most vulnerable sectors and areas, and we will visit these Oro, Santos, Palawan, and Zamboanga City sa sunod na mga araw. So, this coming Monday, pupunta po kami sa presentation kay Presidente sa Davao, pero bago po tayo punta doon, ay dadaan po kami na Cagayan de Oro, and then also later after the meeting with the President, we will go to Santos City. I would like also to congratulate our local government units and our private sector partners for reaching the 14 million mark in terms of anti-COVID jobs administered. Through your relentless effort, we have been able to achieve milestones after milestones with just a few weeks apart. Tunay na napakahusay ng performance na pinakikita ng ating DOH at yung ating mga implementing units na sa National Vaccination Operations Center under Yusek Kabotahe. At kami nagpapasalamat at talagang sinusugan po nila, talagang tinututukan po nila yung mga vulnerable sectors like the A2 and the A3. At nakikita natin ngayon na napakalaki ng inusod ng ating mga numero sa ating A2 and A3. Shown here is a table where we are gradually increasing our capacity to inoculate people. From nearly 700,000 individuals in March, we are able to reach more than 5 million jobs in the month of June. Or to be exact, that is 5.4 in the month of June. And for the month of July, we are targeting to inoculate more than 10 million people. Kaya po natin ito makamit. Ang 500,000 jobs po ay malapit na po nating makamit dahil kasi yesterday, nagkaroon na po tayo ng we have reached 391,000. Malapit na po tayo sa 400,000 marks. Nakita natin kung pa po yung ating mga vaccine na dumadating po. Ito naman po ang mga bagay na dapat nating makamit sa pagtatapos ng buwang ito. Una, magkaroon ng higit kumulang na 16 million delivery doses na bakuna ngayong buwan. At ngayon po, 34% na po ang dumadating. Pangalawa, maiturok sa ating mga kababayan na nasa priority ang 10 million doses na vaccine. We are now at the 37%. Pangatlo, ay may natin yung nasa 300 to 400 jobs kada araw. So malapit na natin ma-break ito. Hopefully, we can maintain this by next week. At pang-apat, magkaroon tayo ng more or less 7 million katao na makakuha ng kanilang second dose at maging fully protected and vaccinated. With the coming of the J&J single shot, hopefully, we can achieve this target. At nakikita po natin na ngayon, na-break na po natin yung 4 million mark ng ating ma-achieve na second dose. At with the presence of the J&J, 3 million, nakikita namin kung bakuna magagamit po natin ito agad, magiging 7 million na po tayo. And then also yung panglima, matapos ang at least 90% ng healthcare workers natin kanilang second dose. By August, we also aim to fully vaccinate 1.8 million government workers, including teachers and security forces, as well as the 2.2 million overseas Filipino workers and seafarers. This will bring us to a total of 4 million to be vaccinated on our public worker sector. The succeeding shipment of Sinovac, AstraZeneca, and Pfizer vaccines are expected to arrive in the last 2 weeks of the month. This will bring our vaccine supply inventory to more than 34 million doses, with a total of arrival of 16.7 million vaccine doses this July. For the month of August, more than 16.5 million from the different manufacturers are due to arrive, including the 4 million from COVAX facility and 8 million from Sinovac. Based on our simulations, if we will be able to keep momentum of our daily throughput, and we will have a steady arrival of vaccine doses, we will be able to hit the 30 million mark in the total of jabs administered by August and reach the 40 million mark by September. Ito yung first dose. And then we must continue to maintain our focus as we ramp up our vaccine deployment and administration strategy. But we must also face the reality that our procured and donated vaccine supplies are still insufficient. This is why we have to be strategic and efficient in allocating these life-saving vaccines to the most vulnerable areas in the country. The implementation of the phased vaccination program is based on health, economic, social, and security risks, and the preparedness and capacity of the LGUs and the availability of the global vaccine supply. Our focus areas still include NCR, Metro Davao, Metro Cebu, Laguna, Bulacan, Rizal, Cavite, Pampanga, and Batangas. We have included in our list the provinces of Bataan, now na naka-MCQ siya, at saka Pangasinan, based on daily attack rates and active cases. Our main objectives are to save lives and minimize local transmission in these high-risk communities. The identified expansion areas include Cagayan de Oro, Iloilo, Zamboanga, Peninsula, and other areas as shown. We are also keeping close watch on the BARMS border to ensure that the travelers coming from Indonesia and Malaysia will not bring in the COVID-19 Delta variant in the country. Finally, the national government will continue to accelerate the implementation and expand the coverage of our vaccine program in order to realize its goal of inoculating 70 million Filipinos by December and achieving herd immunity by year-end. Makakatiyak po tayo na ang ginagawang pamahalaan ng lahat na makakaya upang matagumpayan ang ating laban sa kontra COVID-19. Kaya tayong lahat po ay magkaisa at magtulungan. Katulad po ng pangako ng ating mahal na Pangulong Rodrigo Roa Duterte, walang maiiwan at walang iwanan. Maraming salamat po.
Thank you very much, Secretary Carlito Galvez Jr. Now, Dr. Ana said we need to be vaccinated, and now the vaccines are here. May I ask Dr. Edsel Salvania, ano nga po ba ang efficacy or effectiveness ng mga bakuna natin against the variants that we are seeing?
So thank you very much, Laura. Good morning to everyone. I'm just going to share my screen kasi this is something that keeps coming up. So I think I'm just going to hit the nail on the head with explaining kasi lahat ng tao sobrang atat na atat talaga sa antibodies eh. That's only half of the response to our vaccines, okay? Dalawa po ko ito. Yung antibodies po, parang little guided missiles yan ng ating katawan na pumapatay sa bacteria at viruses na hindi nakapasok sa ating cells sa katawan. Now, meron pang isang component na very important, lalong-lalo na for preventing severe disease, at ito yung tinatawag na cytotoxic T cells. Parang special forces soldiers po ito. Nahahanap po niya yung virus or bacteria na nagtatago sa loob ng ating cells at pinapatay po niya ito. So remember, antibodies, yun yung kung meron tayong kalaban sa labas, at yung cytotoxic T cells, yun yung kung may kalaban tayo sa loob. Tapos, ito lang po yung, wag na natin basahin yung details dito. Yung point lang dyan, yung parang letter Y, yan po yung antibodies na hinahanap po talaga niya parang guided missile. Dumidikit po talaga siya doon sa mga bacteria na dumulutang-lutang sa dugo natin. Kaya po siya effective dahil pag dumikit po siya, lalong-lalo na yung tinatawag na neutralizing antibody, dumidikit po siya doon sa pyesa ng virus na dumidikit doon sa cell para makapasok siya. So kumbaga, parang hinaharangan niya na maka-infect ng cell yung isang virus or yung bacteria. Now ngayon yung cytotoxic T cell naman, hinahanap talaga niya yung virus sa loob ng isang cell at pinapatay niya. Kaya importante ito pag nakalusot na, hindi na siya na agapan ng antibody, pag nakapasok siya dun sa kalaban dun sa cell, mahahanap pa rin, mahahabol pa rin ng ating cytotoxic T cells at ito po talaga yung importante para hindi tayo magka-severe disease. Kasi kahit makalusot siya dun sa antibody, mahahabol pa rin at masastop pa rin yung spread ng infection using our cytotoxic T cells. Now, bakit importante to? Kasi yung antibody natin, konti lang ang gumagana laban sa COVID. Nakikita niyo yung arrows na yun, yung antibody. Merong spike protein, merong nucleocapsid protein. Yan lang po yung mga effective na antibodies. In fact, isa lang, yung spike protein, ang gumagana para ma-stop nung bakuna yung isang COVID, yung isang SARS-CoV na virus para pumasok sa cell. Pag nag-mutate yung spike protein, bumababa po yung bisa niyan. Now, yung doon sa cytotoxic T cells na ginagamit sa bakuna natin, tingnan niyo po yung nasa left. Ang dami-daming tinatawag namin na epitopes. Lalong-lalo na po yung mga whole inactivated vaccine, marami pong pyesa ng virus yan. So, lahat po yon gumagana para sabihin sa katawan natin na, uy, magpadala ka dito ng cytotoxic T cells. Pero yung antibody, konting pyesa lang. At kung nag-mutate yung virus, lalong-lalo na sa spike protein, bumababa po yung transmission blocking bisa ng ating mga bakuna, pero hindi po bumababa yung T cells. So bakit po ito importante? Dahil yung ating neutralizing antibodies for transmission blocking, para hindi ka makahawa ng iba at sa loob ng katawan mo mismo, hindi nakahawahan yung iyong cells. So nangyayari po problema dyan is dahil yung variants po natin, spike protein yung mutations nila, bumababa yung transmission blocking na bisa ng ating mga bakuna at nagkakaroon ng either transmission to other people or nagkakaroon ka rin ng sintomas, bagamat mild. Bakit mild? Kasi meron ka pa rin T cells, yung cytotoxic T cells na kahit makalusot siya doon sa antibody, hahanapin yon ng kawal ng iyong katawan at mapupuksa niya yung mga nagtatagong virus sa iba't ibang parts ng iyong katawan. So very, very important. It's not just the antibodies, it's your cytotoxic T cells that protect you from severe infection, and these are much more resilient to yung kahit ano pang mutations na gawin nung virus dahil iba't ibang pyesa ng vaccine ay gumagana para sabihin sa ating katawan, okay, may virus dyan sa loob ng cell na yan at magpapadala siya ng kawal para patayin yung virus at hindi na magkaroon ng severe disease ang isang tao. So, itong talagang problema with the variants. Kasi alam naman natin yung variants, puro spike protein talaga yung mutation. So nakikita natin sa Israel, pati yung Pfizer, 64% na lang yung kanyang efficacy against symptomatic disease. Pero kung mapapansin natin, napakababa pa rin ng level ng mga taong namamatay. Dahil kahit na hindi gumagana masyadong mabuti yung ating neutralizing antibodies, gumagana pa rin yung ating cytotoxic T cells. And so all vaccines seem to remain robust against severe disease. Dahil meron po tayong second line, yung ating cytotoxic T cells, na kahit makalusot sa antibodies yung variants, mahahabol pa rin nila dun yung mga viruses na nagtatago sa katawan natin. So ang importante talaga, continue po tayo, vaccinate the most vulnerable so that they survive, pero dahil mas mababa na yung tsansa na hindi na ma-block yung transmission, kailangan pa rin po natin gamitin yung ating mask, yung shield, and PDITR para ma-minimize natin yung transmission to other people and also to decrease the risk of the emergence of variants. So finally, ito naman laging tinatanong ng mga tao, maganda ba Christmas natin? The answer is yes. If we use all the tools available to us, alam natin medyo mas konti na yung efficacy ng ating vaccines against transmission blocking. Pero mabubuhay pa rin ang mga tao. Gamitin natin yung vaccines. On top of that, public health standards, strict border control, mas maganda pa rin ating Christmas. Whether or not nakamask pa rin tayo, well, at least buhay po ang mga tao, but at least everyone will be present. That's the best present po. And no one else will have to die from COVID-19. Thank you very much.
Thank you, Dr. Edsel, for clarifying that the decrease in effectiveness is really more sa transmission blocking, no? Pero epektibo pa rin in preventing hospitalization and death. Ngayon po, we'll begin with our questions na po, no? First, I'd like to direct this question both to Yusek Rosette Vergere and Yusek Epimaco Densing po, no? Regarding po our contact tracing efforts. Ano po yung particular, ano na po yung mga ginagawa natin, no, to contact trace yung mga close contact, particularly for the 2 local Delta NCR cases? How many close contacts did these cases have, and how many of them have tested positive, and were they immediately isolated? In the same breath, ano po yung particular areas, Region 610 at NCR, kung saan nakakita tayo ng local case? May localized lockdown na po ba tayong gagawin? So, in a nutshell, what are our contact tracing efforts, and what will we do to these areas where we've seen these local cases? I'll begin with you, Sec. Rosette.
Yes, thank you, Laura, and good morning again. Good morning po, Sec. Charlie, and to our experts and Sec. Epi Densing. Kahapon po kami po ay nagpatawag ng meeting sa lahat ng mga concerned centers for health development po natin. Ibig sabihin yung amin po mga regional officials. Pinatawag din po natin yung mga local governments identified para po makausap natin sila on how they can strengthen their efforts since there is this detection already. Unang-una sa contact tracing, kailangan pong maintindihan ng ating mga kababayan na kapag ang isang tao po ay na-detect na positive, kahit wala pa hong whole genome sequencing yan, meron na ho tayong protocols for contact tracing. Meaning, nung na-detect po yan, nung time na sila ay na-swab at nag-positive sila, nakapag-contact tracing na po ang local governments natin. So ang tanging paalala po namin at saka guidance sa ating local governments, nung atin po silang nakausap kahapon, they need to do back tracing also. Kailangan po makita natin yung ma-expand natin yung pag-trace natin ng contacts para malaman po natin up to the maybe 3rd generation kung kakayanin para magawa po natin at makita natin kung sino pa yung apektado. So when we talk about contact tracing, they were already traced when they were identified as positive individuals. Ngayon po ang gagawin na lang natin, magbaback trace po ang ating mga local governments to further expand these tracing efforts. So I think Sec. Epi can supplement my answer, and maybe Laura, si Sec. Charlie, baka he might want to chime in also.
Yeah. Thank you, Yusek Rosette, sa ating mga media partners, sa mga kasama sa gobyerno. Magandang umaga po. Matama po yan. Mula nung there was an emergency meeting yesterday, and the first thing that was directed to us was to do contact tracing, and in this case, back tracing up to the 3rd generation close contact. So ongoing po yan ang ginagawa natin ngayon hanggang sa ma-identify natin itong mga close contacts and their current statuses. And earlier today, prior to this presser, I met with the governors, mayors, and the regional task force and regional IAT of Region 6, particularly because this is the region of concern. And while I have not disclosed that there's already a Delta variant found in Western Visayas, I gave special emphasis that the bulk of the genomic sequencing which was revealed to us yesterday was really marami po dong alpha and beta variants. And we are looking at the possibility na ang dahilan kung bakit hindi bumababa ang kaso sa Western Visayas, particularly in Iloilo and Iloilo Province City and Iloilo Province, dahil nga dito sa mas mabibilis na variant na existing na sa probinsyang ito. Kasi 4 weeks na naka-MECQ ang Iloilo City and Iloilo Province at hindi pa bumababa yung kaso. And there were discussions to put the city and the province under ECQ. But again, any disclosures to that escalation shall be the IATF has a final say. In the meantime, our discussions really in that region for now is to have a daily monitoring, kundi lang daily, every few hours monitoring dahil ganun po kabigat ang sitwasyon sa Iloilo and province and Iloilo City. And part of the directive is really to improve their contact tracing capability. And more importantly, itong continuous communication with the public. And the directive also yesterday from Secretary Galvez and Secretary Duque is not to withhold information and let the public know that such variant already exists in their local government so that they will be aware and be more accountable to what they're doing in the local government. So ganun po ang ginagawa natin at hindi na po biro ito. And this is a special emphasis that we will be communicating to the local government units of concern in Region 6, Region 10, including Manila, no? as mentioned a while ago.
Thank you, Yusek Densing. To Secretary Charlie po, with the local detection of Delta, ano po ang ating gagawin ngayon to prevent further spread of these variants? Sec Charlie.
Nakita natin meron tayong tinatawag na SOP na drill dyan sa tinatawag natin na nagkaroon na tayo ng mga variants before. So ngayon, ang ginawa natin, nung nalaman natin, nagkaroon tayo ng emergency conference to be nagkaroon si DOH at saka yung lahat ng key personality ng National Task Force. Immediately, ang ginawa namin, tatawag kami sa ating mga LGUs, LGUs, and then decided na puntahan kaagad namin yung mga areas na yun. So, we're going to our weekly meeting with the President. So, lilipat muna kami sa Cagayan de Oro sa Region 10 to confer with the Region 10 LGUs, and at the same time to prepare them to really to contain yung area. Kanina tinawagan ko si Mayor Moreno, and sinabi ko sa kanya na talagang pagtingin niya yung tinatawag natin na contact tracing at saka yung testing and also yung immediate isolation ng ating mga possible person of interest. So yung Cagayan de Oro is becoming now a concern of interest. So sa ngayon, tinatawagan natin pati yung kasama ng Hingoog City and certain suspicious areas na pwede nating makita na may tayong suspicion na magkaroon ng tinatawag na mga different variants. Kasi nakita natin na hindi mabababa ang mga kaso. At sa ngayon ay talagang pag-iiktihin namin yung guidance ng ating mahal na Presidente. Once na nagkaroon ng surge, ay kailangan puntahan ng area. So pupuntahan po namin ang area ng Cagayan de Oro, and then Davao, and then
Salamat po, Secretary Galvez. Now, on questions regarding the transmission of the virus, we would just like to clarify if this is already local transmission or at the level of the community transmission na po. Since these cases were detected last month for Director Thea, how likely is there local transmission of the Delta variant? And what is the parameter used to declare a certain variant to be dominant in one certain area? I guess, Director Thea, we can also say kung ano ba yung naging impact din, no, nitong Delta variant, kung meron na nga ba sa cases or sa pagtaas ng mga kaso.
Salamat, Laura. So, siguro simulan natin na i-define ano ba yung diferensya ng local sa community transmission. Sinasabi lang natin pag local transmission, may ebidensya tayo ng isang local case na may Delta variant ay nakahawa na sa isa pang local case. At dahil doon, yung ikalawang yun, meron na ring Delta variant. Pag naman community transmission, yung local transmission na yun, kumalat na siya. Marami or a large proportion or number of cases already have this variant. And at the same time, hindi na natin sila malink saan ba na sila nakakuha ng infection o di kaya, sino pa kaya yung nahawaan nila. Sa ngayon, ang masasabi natin, meron na tayong local cases. At yung term nga ni Dr. Edsel kanina, it is sporadic in some of the areas. Meron tayong clustering doon po sa ibang mga rehiyon. Pero ito po ay pinag-aaralan. Ini-investigate pa natin kung may linkage ba sila sa isa't isa. At of course, gusto nating makita saan kaya nila potentially nakuha itong Delta variant na to. Nabanggit din po ni Yusek Rosette na dahil ang protocol naman natin, with or without any whole genome sequencing, we should be immediately doing the contact tracing. Then at the least, the close contact should already have been identified and quarantined. And ang additional layer na lang natin ng protection dito ay yung paghahanap ng second to third generation contacts at yung pagtitingin, pagsisigurado na nakakompleto ng isolation at quarantine ng mga ito para ma-ensure natin na wala tayong forward transmission. Okay. Laura, did I miss out on another query? Sorry.
That's good na po, Director Thea. I guess yung next question din dito na sagot na din partially Yusek Densing is i-recommenda na ba natin na mahigpit ng mas mahigpit na quarantine classification ngayon that we've detected local cases ng Delta variant? Yusek Densing or Yusek Rosette?
Laura, yung ngayon kasi ang Iloilo, for instance, in province and Iloilo City is naka-MECQ sila only for 1 week to give them a reprieve to improve their COVID-19 health statistics and hopefully to improve by July 22. However, with this new development, the IATF may have to pass a new resolution if ever they will continue with that present community quarantine in Iloilo City, and most probably even the affected LGUs in Region 10, specifically Cagayan de Oro and the province of Misamis Oriental. And we will await for the final say of the IATF whether there is a need to escalate them to a higher community quarantine classification from their current MECQ to most probably ECQ.
Laura?
Yes, go ahead po, Yusek.
Yes, I just like to explain also, no. So I second what Yusek Epi said. Kailangan po natin lahat maintindihan that lockdowns or restrictions will be part of our response. Kasi po ito po yung isa dun sa sinasabi natin na four-door policy pagdating sa komunidad. This would help us contain kung sakasakali itong variant na ito dun sa lugar na yon. Kaya lang, pag tinignan po natin kasi yung ating trend as to the identification or detection of these variants across these places, parang sporadic po siya, no? Hindi po siya naandun lang sa isang lugar na marami sila na parang nagka-cluster. So nakikita ho natin pa isa-isa sa iba't ibang lugar. So dito po, atin pong kinausap din naman ng ating local governments yesterday with our DILG. Our foremost or primary strategy for now would be granular lockdowns. But katulad ng sabi ni Yusek Epi kanina, kung nakikita natin that the area has a surge, tapos meron pa siyang Delta variant, yan po yung pag-uusapan sa IATF kung kailangan po nating i-escalate further itong mga areas na ito. So yes, the recommendations will be there. It might be granular lockdowns when there are just, there is just one case. Pero kung kasama po sa surge nila yan, tas may Delta variant, we will be recommending a stricter classification for that specific area.
Salamat po. Director Thea, categorical answer. May local transmission na ba?
Ako po, I would say not yet because we haven't been able to link that one case has been able to infect another. Kung titingnan po natin doon po sa WHO definition, meron sila wala. And then we have sporadic na pa isa-isa pa lamang. And then kasunod nun, yung local nga po na meron ng infection from one local case to another. But of course, we are continually investigating it.
Thank you, Dr. Thea. I think on that note, I'll ask Dr. Cynthia and Dr. Eva. No? So if the Delta variant was detected locally, would it then be possible na nangyari yung natural mutation, or was it still sourced from abroad, Director Cynthia?
So for everybody, 100% sourced from abroad, okay? So we have done genetic analysis of all the Delta variants in the Philippines. They are all rooted in samples abroad. Some of them are very closely linked with clusters in India. Others are in United Arab Emirates. Others are probably in Southeast Asia. So wag po kayong maniwala na natural nag-evolve dito yung Delta sa atin. Kasi for it to be classified as Delta, marami siyang hallmark mutations na nagka-classify sa kanya sa Delta. And hindi yan nangyayari yung siyam na yung mutations from the local population. It must have been introduced from foreign travelers. Yun lang po.
Salamat po, Dr. Cynthia. Ngayon naman po, para kay Secretary Galvez and Yusek Vergere, we've mentioned that we actually are experiencing a head start, no, race against the variants, considering yung ibang countries po nakakakita tayo ng pagtaas. How are we using this head start so that we're able to prepare the Philippines po kung magkaroon man ng local or community transmission, no? So may mga babaguhin po ba tayo sa existing protocols for testing, contact tracing, and quarantine? Do we have enough oxygen, or how are we planning to ensure that there will be enough? And for Secretary Charlie din po is, how are we going to reallocate the vaccines now that the vaccines that are coming to the country to also help cushion the spread of the variant? So Sec Galvez po muna.
Okay, yung sa natin, yung sa first question natin, na talagang well prepared na tayo sa Delta. Nung nakita natin nagkaroon ng tinatawag nating havoc dito sa India, nakita namin na we have to prepare everything in scale. So yung PDITR natin, we prepared it in scale. Ibig sabihin in scale, ibig sabihin kung meron tayong malakihang large scale na tinatawag natin mga hospital at saka marami tayong mga tinatawag na magiging casualties, kailangan talaga maganda tayo. So yung preparation namin, ginawa namin preparation unang-una, yung lahat ng mga hospitals talagang in-upscale namin yung tinatawag namin na binigyan natin ng mga pondo para makapag-stockpile ng mga tinatawag natin ng mga treatments. Second, nakita natin na talagang si Secretary Villar, yung ating isolation SAR, nagpagawa ng mga hospital na nakita natin yung tinatawag na modular na 110 per hospital. Dito sa Manila, marami tayong ginawa, and then also marami tayong ginawa doon sa mga areas ng mga ating mga local government units. Nakita natin na nagkaroon tayo ng surge previously last year at this year. And then nakita natin yung sa Manila, nagkaroon tayo ng inaugurations ng mega hospital doon, modular hospital na more or less 336 beds. And also, nakita natin, nagkaroon din tayo ng inauguration ng One Hospital Command dito sa PICC recently. So, ganun ang preparation natin. And then ngayon, nag-uusap nga kami na magbuo kami ng isang malaking command center dito sa PICC, nandun ang IIT at nandun na rin ang NPO, para magkaroon ng isang tinatawag na one cellar lang yung ating One Hospital Command at saka yung National Task Force na nandoon sa isang area lang. And then nag-usap din kami kahapon nung nagkaroon ng emergency conference, nag-usap kami kaagad ng mga regional NBOC, yung tinatawag nating Regional National Vaccination Office. At nagre-direct kami na tama-tama naman po na yung nagbigay ng directive si Presidente. Nabigyan natin ng regions yung July, bigyan natin ng mga vaccine tong mga regions. So ginawa namin yung intended na 10 million na darating ngayong July, 10 million, ni-reallocate namin yan sa mga regions. So nakita natin yung region na 3, meron tayong mga more than 1 million. Yung region 4, meron tayong another 1 million. Yung region 7, 700,000. And ngayon, ang directive namin, yung darating na Johnson & Johnson, ibibigay natin yan sa mga tinatawag na area of interest dito sa Region 10, dito sa Metro Manila, at saka dun sa Region 6. So yung J&J kasi, one shot yan. And ngayon, ang gagawin natin, focus natin ang ating inoculation doon sa mga vulnerable sector, lalo na yung A2. So, ang maganda naman, nakapag-prepare din tayo, si Yusek Kabutahe, nagkaroon siya ng directive na tutok A2. So, yun ang gagawin natin na kailangan talaga yung A2 natin ngayon ay talagang tutukan natin para mabaksinate po natin. So, meron tayong darating na 3.2 million na J&J. At yun po ay tututok po natin sa A2.
Thank you so much po, Secretary Galvez. Yusek Vergere, may dagdag po tayo. Kamusta po ba ang lagay ng oxygen natin sa bansa?
Yes, thank you, Laura. And I second again Secretary Galvez's statements. No? So lahat po ginagawa na. Alam niyo po, ang pinaka-importante dito po sa ating bansa, we were given time. Nung nag-umpisa po yung India, dito po sa kanilang surge, nakita na po ng ating gobyerno kung ano ang maaring mangyari sa mga bawat bansa na maapektuhan ng Delta variant. Kaya po ang ating gobyerno sa pamumuno nga ng ating mga officials, nag-umpisa na po tayong mag-prepare ng ating health system. And as what Secretary Galvez has mentioned, additional beds were established. Nagpa-ano tayo ng mga iba't ibang mga paraan para ma-intensify ang ating PDITR. And ito nga pong oxygen supply natin with the collaboration with the Department of Trade and Industry, nakapag-inventaryo po tayo. Tinignan po nila yung ating mga manufacturers dito po sa ating bansa ng oxygen at nakita naman po na yung pinoproduce ngayon ng manufacturers is enough for our needs, existing needs. At meron pa po tayong surplus. Tinignan po din natin lahat ng ating ospital as to their existing needs for oxygen, nakapag-inventaryo, lahat po sufficient ang kanilang supply sa ngayon. Pero ang atin nga pong abiso at saka nanghingi rin tayo ng tulong sa DTI kung maaring i-add pa, no? Dagdagan pa yung pag-produce because apparently in other countries, yung oxygen na kailangan kapag naapektuhan ng Delta variant is twice as much as what we need in this current time. So sa ngayon na may surplus tayo, gusto pa ho nating dagdagan para mas magiging handa tayo. Lahat po ng efforts natin ngayon are anticipatory. We are not going to wait that we will get overwhelmed tsaka tayo a-action. Kaya po yung mga sinabi ni Secretary Galvez, lahat po yan ay ginagawa na natin simula pa nung nalaman natin itong Delta variant ay naka-apekto sa sistema ng ibang bansa.
Salamat po, Yusek. I have few questions po regarding efficacy of vaccines, no? So to Dr. Edsel po and any of our experts, no? What does it say that the Delta variant is spreading even in nations where more than 50% of their populations have been inoculated with Pfizer, Moderna, and other quote-unquote quality vaccines daw po? Doc Edsel and then Dr. Ana.
Yeah, and that's exactly what I was explaining kanina. Kasi yung spike protein, yun talaga yung nag-mutate sa ating mga variants. And the antibodies, the blocking antibodies are much less effective. Pero the T-cell responses remain. So mahahawa ka man at nakakahawa ka man, hindi ka mamamatay. So nandun po tayo sa level na yon. So at least parang last line na natin yan. Kahit makalusot sa'yo, at least hindi ka mamamatay. But of course, you want to protect people around you. And that's where yung paggamit natin ng mask, physical distance at yung dagdag po natin na protection dito sa Pilipinas, yung face shield. Kaya po siguro hindi kumalat itong mga nakita natin na sporadic cases kahit end of June nangyari is because we have extra layers of protection.
Salamat po. Dr. Ana, would you like to add?
Yes, Laura, just to support the points that Dr. Edsel mentioned, siguro ang importanteng ma-differentiate natin is ang pagkalat, hindi yan equivalent to mataas ang mortality rates or rates ng pagkamatay. So, di ba babalikan na naman natin yung goal natin for the program. Ano nga ba, di ba? Yung mabigyan ng proteksyon ang mga vulnerable para hindi sila magkaroon ng malubhang sakit or hindi sila magkaroon ng increased risk of death. So yan ang inuulit-ulit natin. Kaya talagang napakahalagang mabantayan yung A2 and A3 segment. Kung hindi pa tayo 100% sa A2 sa isang lugar, I think there needs to be much more to do, no? Lalo na ngayon na nandito yung na pick up natin na may mga pangilan-ngilang kaso na ng Delta, this should be an extra motivation, no incentive for everybody to keep on moving with the A2 and A3 vaccination. Siguro babalikan ko rin yung basic concept natin na ang bakuna hindi naman nag-guarantee na hindi tayo mahahawa or makakapanghawa. And we have to remember that because that's the case, yung mga MPHS na dati pa nating ine-emphasize should continue to remain in place.
Dr. Isa Alejandria po.
Yes, Laura. Just also to support what Drs. Edsel and Dr. Ana said, the importance really of still maintaining our health standards, our public health standards, wearing face masks, ensuring physical distancing, avoiding super spreader events. Kasi while we are vaccinating already, we are still not at that level that we have covered all our vulnerables. And the question, while there other countries they have been vaccinated already, but they still were affected by the Delta variant. So if you look at what US, they started relaxing already their public health measures. They're not wearing masks anymore. And we know that these variants, as explained by Dr. Edsel, lessens the transmission blocking efficacy of the vaccines. Kaya, this is not yet the time for us to relax our public health measures. So strict border control pa rin, enforcing quarantine, isolation, early consult, and most of all, get fully vaccinated. Yun pa din.
Thank you so much to our tag experts. Secretary Galvez needs to go by 12, so I'll be asking na po yung mga tanong po ng media partners natin kay Sec Charlie kung okay lang po. Sec Charlie, they are asking po if meron daw po bang sanction ang LGU kung na-mishandle po nila yung mga bakuna na naibigay naibigay sa kanila. This is in relation po dun sa mga reports na nakukuha natin na nagkaroon ng problema yung cold storage facility po ng LGU. Sec Galvez.
Yes, isang nakikita natin na isang sanction doon is one. Yung for example, ang nasira niya yung Pfizer, we will not anymore give them a Pfizer. Meaning ibig sabihin kasi yung mga tinatawag nating yung mga vaccine na talagang very sensitive na hindi nila kayang i-handle. Talagang i-minimize namin 'yon sa mga LGU na hindi prepared at saka well taken yung mga tinatawag nating cold chain solution. Second, ang gagawin natin talaga, we will sanction yung concerned na LGUs, at the same time concerned tinatawag nating vaccine safety officer. Kasi sa lahat ng ating mga vaccination site, meron tayong tinatawag na vaccine safety officer. Siya yung tumitingin kung tama yung cold chain solution, yung handling, administering, at saka yung tinatawag natin yung continuous inspection ng storage. Kasi in-inspect niyan every 4 to 6 hours every day. So yan ang ginagawa natin na talagang minimize natin talaga yung wastage, kasi talagang sa ngayon ang bakuna ay ginto. So kailangan talaga yung lahat ng nakakatanggap nito na mga LGU, they have to preserve the efficacy and safety of this vaccine. Kasi pagka once na na-compromise ang safety at saka storage, it will also endanger the health of our people.
Salamat po. Yung isa pong tanong dito is, how are we going to distribute the 1.1508 million doses of AstraZeneca that were bought through the tripartite with the private sector? How many doses daw po will go to the government and how many will go to the private sector?
Sa ngayon, yung nakita natin na very limited pa yung sa mga private sector na nakuha. Ang is more 1,000 at saka itong 1,150,000 na natin 1,150,000 na AstraZeneca. Ang distribution nito na-submit na ito sa NITAG at napagkayarihan po namin na ibibigay na po namin fully yung mga kailangan po ng private sector. At yung kalahati po, kasi ang mangyayari po nito, yung kalahati po ng more or less yung 3 million na mapunta sa gobyerno. doon na po namin kukunin sa 2022. Kasi po nahati po yung AstraZeneca, na yung 17 million na binigyan ng private sector at saka LGU ay kalahati po doon 2021, kalahati po 2022. Meaning 7.5 2021 nila ma-receive, 7.5 sa 2022. So doon na po kami kukuha ng ating kahati, yung 3 million nakahati natin sa private sector. Doon na po tayo kukuha sa 2022.
Salamat po, Sec. Some of the questions po is about asking data po, asking data on the vaccine distribution and allocation po. Baka po pwedeng i-send na lang po natin, or would you like to discuss now po?
Yes, yung sa allocation natin, very clear naman yung sinabi ko nga nung isang araw at saka nung report ko kay Presidente, na talagang yung allocation natin, yung 10 million out of that 6 million, ay pupunta po yun sa mga regional equitably. So ang ginawa po naming basis, yung kanilang master listing po ng A2 at saka A3. Kasi po meron pa po tayong more or less mga 12 million na hindi po na-vaccinate na A2 at saka A3. Particularly yung mga second dose. So ang namin po, ang ginawa po namin ngayon, i-distribute po namin doon according to the master listed A2 and A3. And then ang nakita po natin malaking percentage by nakita natin yung NCR, so by 1.8 siya. Yung region 4A 1.5, yung region 3 1.2, yung region 7 at saka region 6 more or less 700, yung Ilocos region more or less 300 to 500. Yung BARM nakita natin kasi na malapit siya, very vulnerable siya sa Malaysia at saka Indonesia dahil meron tayong cross-border agreement. Binigyan din natin siya ng mga more or less 305,000.
Maraming salamat po, Secretary Charlie. For your final message po before you go, thank you.
Susugan ko po yung ating mga expert na talagang sa ngayon po nakita natin na nangyayari sa mga ibang bansa na nakakaroon tayo ng infection sa variant at based on the report talagang predominant ang Delta. So ang nakita natin na dapat po talaga, susugan ko lang po ang sabi ng ating mga expert na talagang yung minimum health standard kailangan po natin na talagang strictly i-impose at saka strictly observe. Kasi nakikita po namin yung mga bansa na talagang nakita natin binabaliwala ang tinatawag nating prevention at saka yung strict implementation ng minimum health standard. Nagkakaroon po tayong tinatawag na surge, nagkakaroon tayo ng resurging of cases. So ako po ay natutuwa na dahil talagang ang ating mga expert ay talagang lagi pong nakatabay at napakalakas po ng ating mga genome sequence analysis at nabibigyan po kaagad tayo ng tinatawag na paunang paalala at saka impormasyon para po makapag-prepare po tayo. So sa lahat po ng ating mga kasamahan sa DOH, maraming salamat. We have a lot of good news and hopefully we continue our working together na sama-sama po tayo, private sector, national government, LGU at saka yung ating mga expert at mga development partners na nandito po ngayon. Maraming salamat po.
Maraming salamat po, Secretary Carlito Galvez Jr. Now we proceed naman po sa key messages din ng ating mga experts. I'll begin with Dr. Cynthia Saloma. Dr. Saloma.
Hello po, everybody. We have been watching our borders and we've been keeping tabs, protecting our borders from the introduction of Delta. Alam po natin na it is just a matter of time na pupunta siya dito, but we were buying time so that we can have increased vaccination capacity. So now that we have seen this in our local cases, it is very, very essential for everybody, particularly the LGU and individually, that we maintain and adhere to the minimum public health standards. The moment symptoms arise, mag-vaccinate, mag-isolate po tayo, and that the gap between the symptoms as well as the seek of RT-PCR result or seeking professional help should be shortened. Nakikita po natin ngayon, despite our efforts, that the Delta variant was able to penetrate some of our borders. And that's also very, very essential that on the one hand, we continue to strengthen our border controls. And on the other hand, on the ground, our LGUs, together with everybody's cooperation, that we help keep the transmission chain. We don't want to experience the cases where we have in our neighboring countries such as Indonesia, with 480,000 active cases. Thailand and Malaysia now has about 100,000 active cases. We do not want to experience that again, and that requires a whole of nation approach and everybody's cooperation. Yun lang po.
Maraming salamat po. Dr. Ana Onglim.
Thank you, Laura. So, uulitin ko siguro yung mga nabanggit na ni Dr. Cynthia. Ang tanong naman na gusto nating sagutin is, paano ba natin pangangalagaan ang ating mga sarili at ang ating mga pamilya laban sa Delta variant? Mabuti na nga lang na ang dati na nating inirekomenda ay nananatiling mabisa. Yung pagsunod sa minimum public health standards, hindi pa rin yan matatawaran. At mabuti na nga lang na meron ng available na bakuna na makakapagdagdag ng isa pang additional at mabisang layer ng protection. So siguro ang reminder na kung ikaw ay qualified ng tumanggap ng bakuna at hindi ka pa nagkakaroon ng pagkakataong magpabakuna, please samantalahin. No? Kung ikaw ay particularly A2, A3, A4 na nagkakaroon na ng rollout sa iba't ibang parte ng bansa, let's please take advantage of this opportunity to be protected. Idagdag ko na rin siguro, kung ikaw ay nasa age group na qualified tumanggap ng iba pang mga bakuna laban sa mga respiratory tract infections tulad ng flu or pneumococcal disease, dapat samantalahin din. Kasi in as much as ayaw nating magkaroon ng COVID, ayaw din natin magkaroon ng ibang sakit na pwedeng magdala sa atin sa ospital. At makikipagkompetensya pa tayo dun sa resources na kailangan nating ilaan para sa COVID response. And then finally, yung ating response na kailangan nating paiksiin, yung interval between symptom onset and detection of a positive case, napakahalaga. This is also behavior driven. Nasa sa atin kasi to. Alam ko na ayaw natin no, na tayo ay madadiagnose bilang isang COVID patient kasi syempre nakakatakot, meron ding question about stigma, meron din sigurong implication sa ating kabuhayan. Pero tandaan natin, habang dumadaan ang oras o araw na hindi tayo identified as a positive case, we endanger our families and we endanger the people around us, no? So, in as much as kung kaya na nating masabi na tayo ay positive, makakapag-isolate tayo at magko-quarantine yung ating mga pamilya, napakalaking tulong yan para mapigilan ang pagkalat ng sakit. Thank you.
Salamat po. Yusek Epimaco Densing.
Ay, una sa lahat, sa ganitong pagkakataon, gusto ko sanang bigyang pugay ang ating mga governors and mayors at iba pang mga lokal opisyales. Alam niyo po, para maintindihan niyo po, ang nahihirapan din po yung ating mga governors, mayors at barangay officials sa sitwasyon ngayon. At sana po tuloy-tuloy tayong magsuporta sa ating mga opisyales, pati na rin po sa amin dito sa national government. But because our local officials are the frontliners in the local government units, we must give them their support, that we must continue to listen all their pronouncements and executive orders. And to our local chief executives, what we want them to do is really to continue to communicate with their constituency on a regular basis, that they be updated what's happening right now, especially so that the variants of concern are already present in our country. Itong Delta is something that we've been talking about in the last few months and has become the foundation of many of our health protocols for our overseas Filipino workers and returning overseas Filipinos, including that of the many local government units. And it has now come to our faces right now that the Delta variant that we've been preparing for is already here. So sa ating mga kababayan, sana po lagi po kayo makikinig, wag po kayo makikinig sa fake news. Kung alanganin po ang impormasyon na nakukuha po ninyo, mag-research po tayo, magtanong sa ating mga health officials at makinig po tayo sa ating mga mayors and governors sa kanilang mga direktiba. Ito na po ang panahon para magkaisa po tayo at wag na po tayo magturuan, no? Wag tayo magturuan kung sino may kasalanan, sino hindi nakagawa ng trabaho. Importante po magkaisa na po tayo. And lastly, again, and this is the public, sabi nga ng ating mga health experts, ang ating mga responsibilidad ay una, panatagian nating malakas ang ating katawan at malusog. Pangalawa, lagi nating i-practice ang minimum public health standards, pagsusuot ng face mask, face shield, social distancing, paghuhugas ng kamay. At importante po kung ang bakuna ay nandiyan na po sa harap natin at marami pong bakuna na darating ngayong buwan. As Secretary Galvez has mentioned, we're expecting around between 11 to 16 million doses arriving this month of July. Pag nandiyan na po sa harap natin ang bakuna, wag na po tayo magdalawang isip, magpapakuna po tayo. Yan po ang tanging tulong na lang po natin na mamibigay natin sa ating bansa at sa kapwa nating mga Pilipino. Magandang umaga po.
Magandang umaga po at salamat sa inyong mga paalala, Yusek Densing. Pare naman po mula kay Dr. Isa Alejandria. Dr. Isa.
Okay. Thank you, Laura. Nasabi na lahat, no? But I think just to emphasize, no, ang kalaban natin ay ang virus, no? So, and the virus is still emerging. So, the reason why it continues to emerge and to have this emerging to transmissible variants is because cases are still there. So, kaya kailangan pa rin pag-igtingan ang ating pagpigil, no, ng virus, ng pagpasok ng virus sa ating bansa. Okay? So, yung PDITR, tapos yung strengthen yung ating public health standards, no? So, again, hindi pa oras para mag-relax. Nakita na natin ang mga nangyari sa ibang bansa and we have that, luxury na we are learning, no, from the lessons of other countries, and we are thankful also that we have the genomic surveillance, no, that is able to guide us in our policies, no, and we are now trying to avoid this strict nationwide lockdowns because timely na nakikita natin kung nakapasok yung virus. So na-identify na natin kung ano yung areas na dapat nating pag-igtingan pa, no, ang measures natin. Okay. So again, let us, I know medyo napapagod, but let us make it part of our lives, no, yung public health standards, because we are preventing not just COVID, but other diseases as well. And it's our responsibility to protect not just ourselves, but everyone. So public health is everyone's business. So sa ngayon, let us still continue to wear masks, avoid big gatherings kasi doon nagkakaroon ng aerosol transmission, so we need to ensure proper ventilation. Okay. And lastly is really get vaccinated, fully vaccinated. Tayo dapat lahat. So solidarity among all sectors. Tulong-tulong tayo.
Salamat po, Dr. Isa. Ganda po ng inyong paalala, solidarity. Dr. Eva Maria Cotionco de la Paz. Nauna na po ata siya. Sige, kay Dr. Edsel Salvania na po. Pero bago yan, Doc, may tanong kasi dito kung yung T-cells daw ba effective din sa lahat ng variant. So, pakidamay na din po. Thank you.
Yeah, of course. Sige, let me answer the T-cells muna. Nakita naman natin na hindi lang isa ang target ng T-cells. Marami. So, ibig sabihin yan, yung mga bakuna natin, kahit medyo alanganin na siguro yung neutralizing antibody, buhay na buhay po yung ating T-cell response. At kaya konting-konti ang namamatay na fully vaccinated, kahit man siguro magkaroon sila ng sipon or ubo. Now, yung message ko lang naman siguro, important natin na maintindihan na gumagana po ang ating genomic surveillance. And this is giving us advanced warning talaga in terms of kung ano na yung nangyayari on the ground. But we do not completely just rely on this. Nakikita naman natin yung areas na nagkaroon ng detection like Cagayan de Oro and yung sa region 6, these areas are already under MECQ. So this is part of our layers of protection na pag nakikita natin mukhang may surge na pupuno na po yung healthcare capacity, we already act even without the genomic surveillance. So the genomic surveillance is just one part that continues to guide us. And alam naman natin na ang bilis-bilis po talaga ng pag-increase ng Delta variant sa buong mundo. And yet sa atin, nakikita natin itong mga sporadic reports Sa US nga nakikita mo 20%, 30%, tapos next week 50% na. Hindi pa po yan nangyayari dito, which means that what we are doing, our layers, our border control is slowing down the Delta variant. And we should continue all these measures, including our vaccination, our face shields, our face masks. And kakayanin po natin ito dahil tulong-tulong po tayo, meron tayong advanced warning, nasasanay na rin naman po ang ating LGUs sa paggawa ng granular lockdowns, and hopefully we don't have to do widespread lockdowns, and we can keep our healthcare system from getting overwhelmed, and we can continue to live with the virus and not have to lock down again po. Thank you.
Maraming salamat po, Dr. Edsel. Yusek, meron ba kayong idadagdag?
Meron tayong slides. Just to synthesize and summarize all the points. Okay, so again, bago po tayo matapos, gusto lang muna namin magpasalamat sa lahat po ng ating mga kasama dito sa press conference na to, especially Secretary Galvez, Yusek Epi Densing, and of course, our regular support from all of our experts present. Maraming salamat po. Nais po namin bigyang diin ang kahalagahan ng pagkakaisa nating lahat sa panahong ito. We need to keep each other safe. Sa pag-detect po natin ng Delta variant sa ating bansa, iwasan po natin ang pagiging kampante at sikapin po nating makaya upang mapababa ang mga kaso sa ating bansa, and kailangan na po natin i-activate ang DOORS 3 and DOOR 4 strategy. Ang pagpapaigting po ng ating implementasyon ng PDITR strategies at ang pagpapalawig ng ating strong health and critical capacity para masiguro po natin na maayos na mamamanage ang mga kaso kung sakasakaling tataas sila sa iba't ibang lugar dito sa ating bansa. Kaagapay po ng pagpapaigting ng ating PDITR strategy, next slide please, ng ating lokal na pamahalaan at pagpapalawig ng ating healthcare capacity, sinisigurado po ring mas bibilis at lalawak pa ang ating COVID-19 vaccination rollout. Narinig po natin kanina si Secretary Galvez, at narinig din po natin na in-emphasize niya na sa panahon ngayon, mas kinakailangan po natin ang pagtutulungan at suporta upang ang mga miyembro ng A2 or ang mga senior citizens at A3, ang ating priority groups na may comorbidities, ay mabakunahan dahil mas at risk sila sa mga mabigat at saka seryosong epekto ng COVID-19. Next slide. Nakasagap din po tayo ng mga positibong balita na tumaas na po ang vaccine confidence ng ating mga kababayan. Mula po sa 16% ay naging 43% ang willing na po ng mga Pilipino na magpabakuna kontra COVID-19. Kaya naman katuwang ang bawat isa sa inyo, nananawagan po kami galing sa Department of Health at iba pang ahensya ng gobyerno na hikayatin po natin ang ating mga kapamilya at saka mga mahal sa buhay na magkaroon ng dagdag na proteksyon kontra sa COVID-19. Gayon din po ang pagkumpleto ng inyong second doses. Nabanggit po kanina ng ating mga resource persons na magiging epektibo lang, fully effective ang ating bakuna kung tayo ay makakakumpleto ng pangalawa or second dose of the vaccine. Sa bawat pagtaas po ng ating vaccine uptake, mas lalo po tayong mapapalapit dun sa Happy Christmas na sinasabi ni Dr. Edsel po kanina, kung saan mas kontrolado na po natin ang virus at makakabalik na po tayo sa ating pamumuhay, and tayo pong lahat ay magkakaroon na nung dating as regular as possible yung ating mga activities. Next slide. So sa lahat po ng ating ginagawa, tayo rin po ang magtutulungan upang makatanggap ng benepisyo ng kalusugan at kaligtasan. Kaya't itatak po natin sa ating mga puso at isip ang ating pag-iingat, ang ating pagmamalasakit sa ating mga kapwa, at ang ating pagpapahalaga ng buhay. Bilang sambayan ng Pilipino, magtulungan po tayo tungo sa pagpuksa ng pandemyang ito. Sama-sama po tayong lahat. Let's be the solution to our country. Maraming salamat po.